I'm so glad we're talking about this, because this is the one of the number one unchecked or difficult to manage issues that I see when I get referrals from other clinicians. And basically neuroinflammation is brain fog, right? A person will just have brain fog, but the brain fog will be after they eat something, they get brain fog, or maybe they don't get a good night's sleep, they get brain fog. Maybe they get exposed to a chemical and they get brain fog for a little while, or maybe they just got kind of stressed out, they had a stressful conversation. And different parts of the day, there's different levels of neuroinflammation. The first level is basically intermittent and or you know minimal, where basically they have these transient levels of brain fog throughout the day, decreased function, fatigue, and it basically comes back. But it's basically the person's body and brain telling them, hey, look, when I can't think straight, when my memory goes, when suddenly I'm depressed after a meal, when suddenly I have vertigo after a meal, or if I have alcohol and it's not like it used to be when I have alcohol, I literally can't tolerate alcohol, or if I work out and I cannot exercise the way I used to anymore, I fall apart. That really tells me that they have neuroinflammation. And that is like a moment where, like in a history, I'll drop my pen, because at this moment, we are completely out of the single therapy is going to work model.
Absolutely.
Yeah, now
Yeah. Yeah.
the loculated single approach to case management is completely out the window. And we have to understand at this point, what are the lifestyle factors driving this? What are the infectious disease factors driving this? What are the environmental toxicity factors driving this? What's the stress at home? What's the relationship stress looking like? How much alcohol are they consuming? Are they exercising enough or not enough or too much? And, what kind of diet is going to, make this worse? And are they sleeping? And like, the patient dream, because I teach all over, how to use supplements and how to diagnose things based on labs. The patient dream is that I'm going to put them on one supplement, or since I'm the neurological dude, I'm going to give them like one brain exercise, and rainbows and unicorns are going to come out and they're going to do awesome. I mean, that does happen. Okay. But if they don't address the lifestyle factors that are driving it, then it becomes a problem. And let me just describe a little bit about what's happening in neuroinflammation so people can understand this. Okay. So for every network, for every cell in the brain that would like make us focus or have memory or allow us to speak or allow us to just go about our day, there's 10 neurons that are immune neurons. And what neuroinflammation is when the immune cells in the brain are no longer working to support those networks. So 90% of the brain are actually immune cells. The 10% that people are focused on, like, I'm having insomnia or anxiety or I'm depressed, are supported by this 90%. And there really aren't great medications that have long-term outcomes specifically as a single therapy that support these glial cells. So what we have to understand now is when we're born, theoretically, unless like a child has autism, it's a little different typically, but when we're born, we have these white blood cells, the 90%, okay, that support our neurons. They have like arms on them and they have legs on them. They're like little octopus. They're called ramified, and they're called steady state microglial cell. Okay. And they're called glial cells because they used to be thought that they were glue. And so they just thought they glued together the 10% that actually did the function. But now we understand that they are dynamic systems. And in a steady state, what they do is they help you with neurotransmitter function. They help you make new connections. They help you prune off no longer needed connections. They help with plasticity. And when they're working awesome, you feel amazing. You have clarity of thought. You have good energy. You have no dizziness. You are not depressed. You don't have any anxiety. You pretty much just feel amazing. Okay. But what can happen is you, unfortunately, the big things that cause this are inevitable for some people, which is like a blow to the head. Okay. So like how many times have you seen a little kid like fall off the couch and they just whack their head and you're like, okay, are they okay? Or they have a person has a concussion and they hit their head skiing, they're in a car accident, they slip and fall. And once those glial cells get a shock like that, they lose their arms, and they're permanently forever changed into what's called a primed glial cell. That primed glial cell now becomes basically ready to go for the next thing that happens. So maybe you've heard of somebody who had Lyme and then they got a blow to the head, and instead of recovering from that blow to the head, they have like persistent concussion symptoms. But the reverse is often people will have a concussion when they're a child, or unfortunately things like being molested or being sexually assaulted or having severe neglect. Psychological trauma will also prime these glial cells. And then by the time they get their Epstein-Barr infection, or by the time they get their sensitivity to gluten, or by the time they get bit by a tick, or by the time they get live in that house that has Stachybotrys, they already have so many of these 90% of glial cells are just ready to go into this pro-inflammatory cascade that dominates their life.
And so this explains why somebody can all of a sudden be in chronic Lyme when they just got their tick bite 3 months ago.
Exactly. It also explains why, somebody could live in a house, they could move into a house with their spouse and kids, and they absolutely fall apart from black mold, whereas everybody else is fine. And it drives everybody kind of crazy, because it's like, well, maybe this happens to the husband and the wife is like, well, I'm okay. Like, or why aren't the kids having issues? It's because they actually have a brain that is able to process their environment, help them with detoxification, and they haven't lost tolerance to the mold in their environment. And the person with prime glial cells, they go into that situation and they will go into what's called an M1 activated glial cell, which is pro-inflammatory. That's the brain fog. And whatever network goes down is going to describe what symptoms they have. And so they may get memory loss. They may have trouble finding the word. They may just feel like not doing anything. They may feel like lack of motivation. They may get difficulty driving sooner than they used to. They could have a constellation of findings based upon which network actually has the prime glial cells. So that's absolutely what's happening. But the sad news is that's permanent, but like, folks, don't freak out, because there's a way to get that prime glial cell and activate it from what's called an M1 designation to an M2. So think of a activated glial cell or prime glial cell like an egg. Once a ramified glial cell, which is a raw egg, gets put into the frying pan, that egg yolk changes forever. Okay, but it can be like a nasty egg yolk, like the one you see that's kind of turning like green that you want to avoid. That's the M1 one that gives you brain fog and symptoms. Or it can be like the nice looking egg yolk that actually looks like you could eat and would be super helpful. And that's from that moment on, that has to be accounted for in the clinical picture for that patient.